Okay, so she gave y'all back your, thank you, love. Sure, grab that one. What, these sheets here? Yes. That's, did everybody turn in their sheets? Their time sheet? You did? Okay. Yeah, you can ask her about the book while you're at. And turn this into it too and tell her that needs to be filed away.
Yes, ma'am.
That needs to be filed away. Thank you. Okay, so let's go back through the book here. Let's pick up where we last left off. The table of contents. Come on in, everybody. The table of contents. So we last stopped at the nervous system, the eye and ocular and DEXA, the auditory system, the operating microscope, radiology procedures. I'm sorry, table of content.
Okay.
Auditory system, operating microscope, and then we have radiology. So let me kind of write an abbreviated version of what we went over yesterday. Okay. Okay, so today is May Day.
Yes.
Okay, so chapter 6. So we said E&M codes, and we'll go over that 99201 through 99299. And then we said anesthesia, and that was 00100 through 00122. Can't remember. Then we have surgery. Your surgery codes go from 10,000 to 69999. Okay. Then your radiology codes. Your radiology code go with 70,000 through 79999. Then you have pathology code. Pathology goes from 8,000 to 89,999. Then you have your medicine codes. Okay, your medicine codes deal with like vaccines, your MMR, your DTaP, different vaccines that you get. You know how your children get 3 months, 6 months, 9 months,
4 months, 6 months as well. Babies are getting immunized.
They will. Okay, you got it. Okay, so that's those vaccines. Okay, so they go from 90,000 to 95999. Okay, now you have your physical therapy. For those that may want to do physical therapy, occupational therapy, speech therapy. That goes from 96,000 to 96,999. Then you have your chiropractor, for those that like to work in chiropractic care. Maybe you want to be a biller for chiropractic or chiropractors. They go from, I'm sorry, that's 7. They go from 98,000 to 99,999. Okay, so I'm not asking you to memorize all of this. I'm asking you to be familiar with it. Over time, you look pretty. I like your shirt. You just think looks nice. So over time, you will become very familiar with this. So I'm not asking you to be an aficionado of this. It's going to take you time to know this. I've been doing this for 33 years, so it's like that to me. Okay? All right. So now, let me also say, and I'm going to make sure this gets on the tube.
Oh, yes.
Yeah, kind of see that. Okay, so all of these codes, whenever you're using a code, the PX mean, what's the abbreviation for PX?
Prognosis.
Not prognosis.
No. Procedure.
Procedure. Procedure and DX. What does DX mean? Diagnosis. Okay, very good. Procedure and diagnosis must match to the best there you go, specificity in coding. There's coding, there's billing. In medical billing and coding, you have demographic information. You have coding, which deals with the coder. Then you have the biller or billing, which deals with the job of the biller. Okay? Demographic, these are your appointment setters and your front desk people. Front desk. Okay, now, why did Ms. Harper write this on the board? I'm glad you asked. I'm always assuming you asked. Okay, it's because you need to understand the workflow of billing and how it works. It works from front to back. Front to back. Front office, back office. You understand? So if they say, I need you to work front office saying, I need you to help check patients in. I need you to help put in some information, patient information, demographics in the system while I check patients in. I need you to help set appointments for me. I need you to help probably to verify some information, some patient insurance information. Sometimes you may have walk-in patients and they didn't set appointments, but you have to be ready. So yes, it may look easy peasy, but you have to be a multitasker. How many multitaskers do we have here? I think that's all of us women, right?
Yeah.
Hate to be partial, but it's the truth.
I have a question.
Yes, ma'am.
From this demo information, coding and billing, where will the physician come in?
What is the physician comes in? I'm glad you asked that question. That's a very good question. So front desk, so you have this right here. This is the physician and the nurse and the patient. PT means patient.
Right.
Okay. Then we have the soap notes that's going to be born right there. This is where the soap notes of that patient care begins right there. Okay.
Okay, the PX is what was it?
PX means
Is that prescription?
procedure.
Procedure,
Mhm.
right? And then the DX is the diagnosis.
It's diagnosis.
That's what you were just saying.
Mhm.
Okay, all right.
So I don't want you all to, they already know pretty much. They already know. You all are coming to know.
Yeah.
You all are coming to know.
Right.
I don't want you to overwhelm because all that is part of medical terminology. That's why I said we're going to learn that on the back end.
Yeah.
So
and
good.
I-
Ask me.
And I am getting overwhelmed.
Yeah.
I'm trying to like.
I don't want you to. I don't want you to. I want you to ask me so that when we rotate back around to you, be like, oh, there you go. Yes, ma'am. Ma'am,
Write this down.
you can. I'm going to take a picture of it anyway.
So you said that's the physician and nurse and the PT is the patient. And what
Yes.
is soap?
Oh,
So, glad you asked. Give me just a minute. I'm going to explain. Glad you asked. Where do we live in the soap notes? Assessment. Assessment has the information of what?
The patient.
Patient dealing with what? Two things.
The issue, what's going on?
The
Well, no.
diagnosis and the procedure.
The diagnosis and the procedure. Diagnosis and the procedure. This is where we live. The diagnosis and the procedure code will always be there. As medical billers and coders, it's the doctor's job, the nurse's job, really the doctor's job, the nurse practitioner, whomever, to write down what they did about the patient.
Right.
Procedure codes, this book tells what they did about the patient. Did I spend 10 to 15 minutes with you? Did I send you to get some labs, CBC, or complete blood count, or a lipid panel, or creatinine count, or albumin count? What kind of labs did I send you? Blood work did I send you to do to help me justify the analysis on the document of what your problem may be? Or to confirm my theory of thinking of what your problem may be. Does that make sense? Mm-hmm. Procedure code tells what the doctor did. What the doctor did. What did I do about your problem? Okay. Did I send you to X-ray? To X-ray your arm? Or did I send you on the echocardiogram machine? Or on a treadmill machine to do a heart stress test? I need to know how far can I stress your heart to let me know if you're going to have a heart attack. Or how strong your heart muscles are. That's going to help me determine my thinking. Lola just said, I love to mess with her. Lola just said, prognosis. Prognosis is a guess before a definite diagnosis. Okay. So if you hear someone say, well, what's her prognosis? Well, her prognosis is, or his prognosis could be, those are guesses. Until we get definitive answers. Does everybody understand that? Once we get definitive answers to confirm our theory of thinking, then we can say it is now a what? Diagnosis. Do you get that?
Dr. Harper.
From Dr. Harper. Yes. Absolutely. I'm getting my doctorate next year. I'll be working on that doctorate in public health.
You are?
Mm-hmm.
Oh,
my goal was to be a physician, but my husband can't handle that. I'd be gone too much.
Where are you going to graduate?
UT.
Oh, please
You
let
think
us know.
I will. It takes 3 to 4 years.
I want to see you do that.
Thank you. So I'm getting my doctorate in public health. Huh?
You said you don't think you'll stay gone so much.
Yeah, because when you're in medical school and you do after 2 years of your first 2 years of medical school, you have to do your residency. You at the hospital 6, 8, 12 hours a day, and sometimes double shifts. He couldn't handle that, and we're both in ministry. He couldn't handle that.
You have a lot on your plate.
Yeah, I have a lot on my plate.
Right.
And I wanted to go to med school in 2007, so that was a no. So I settled for an MBA. So I got that. Okay. I'm still hungering for a doctor.
Right.
So you're gonna do it.
Thank you. But with the PhD in public health, a doctorate in public health, I'll be able to do research, but I'll be able to do research from home or from my office and still have room for him. You know? Yeah. It's just one of those marriage things.
Yeah. Those video things now. All across the country, if you find a doctor that you like from somewhere else, they've been starting to do like video conference. Yeah. Maybe you can do that. Yeah, I'd be able to do that.
And that would be really good for you.
Now, the only thing that I would have to do as a requirement, I would have to travel abroad. And that's once a year. But I wouldn't travel far until after 2023. Thank you, darling. Yeah, I'll let you do that. I wouldn't travel far. If I do, it would be like Mexico, somewhere like that. Maybe Canada, somewhere like that.
Those are good places.
Yeah, but to go overseas, I want to be totally finished with my chemo pills. I want to be finished with all my therapeutic pills. Yeah, because whenever you fly, like I gotta fly soon, I have to be 2 weeks off my chemo pills. When I come back, I gotta wait 2 weeks to get back on my chemo pills. If I'm going to Canada, or if I'm going to Mexico, I can drive or ride a train. I don't have to get off my pills. You see what I'm saying? Yeah. So, I just don't want to risk that. No, and I'm already risking it that once this time. So,
But I would love to go. It's just I have to factor out some things.
Yeah.
But I'm excited. I'm very excited. So thank you.
Yeah,
That was confirmation. Yeah, thank you. So, where was I at?
You were explaining the soap notes to her.
Oh, so
Okay, so we live in the soap notes. So what are the two things as medical billers that we're concerned with in the soap notes? And procedure. Procedure does tells what the doctor did. Diagnosis tell what's wrong with you. What's wrong with the patient? Okay, you got that? Okay, super
that
fantastic.
would be like after they write those notes, you can
Sorry?
try to like get a
From
code
1
for
to
it.
8. I see.
Like
Okay,
get a
thank
code for whatever
you.
they want to order.
Thank you
Mhm.
so
Is
much.
that where we'd be at with that?
I just said.
Oh, yes.
Repeat what you said, dear heart.
So like when you get to the soap notes, then do you like pick out the things that the doctor ordered, or is it like
What the doctor wrote about the patient.
Okay, all right.
You picking them out. You're abstracting. Did everybody hear that? What Jennifer said, as medical billers and coders, in the assessment part of the SOAP notes, we're picking out what the doctor and the nurse have said. Mostly the doctor, what the doctor has finally said about the patient. So that is called abstracting or abstraction of information. Okay, that's another job in itself in medical records.
Okay. Oh, thank you. I
Mhm.
like your idea.
Mhm.
I really
In
have been
medical
thinking
records.
about it a lot.
So all you got to do, if you've been thinking about it a lot, then that's for you. That's the path you need to be on, and we'll talk more about that.
Yes,
We'll talk more about that. I think you'll do great with that, and library type stuff.
oh, yes, definitely.
Yeah, yeah, HIM clerk, exactly. So you'll be great at that library. What is it? You like that? Yeah, that's why. Okay, Mom. Catch me on the tube later on, and I'll be lecturing tonight at my other school. So catch me on the tube there too. I think I don't know what I'm lecturing tonight. I'll figure it out. Yes, I do, and they all. Oh, okay. It's okay. Yeah, could you do that? Yeah. So my timekeeper lady, how long do I have before break? About 30 minutes? Okay, thank you, sweetie. So we break about 10 o'clock. I know that's kind of late, but we break about 10 o'clock, and then for like 10 minutes, and then we come back. So right around break time, remind me. My timekeeper lady, she's going to tell me it's time to go to break, and then remind me, and then I will send the picture. I'll send it to Miss Johnson.
Miss Johnson.
Oh, okay. Okay. So remind me, whatever that is. Okay. Okay. Yeah, Miss Johnson. Okay. So let me come back to what I was saying. I'm sorry, because I've been digressing. So this is where we live. So someone asked a question, where does the nurse and the physician and the patients play a role? They right here in the middle. The middle right here between demographic information and code. So this is where they fit in, right there in that work.
So they're like, okay, so the demographic is like the address, phone number.
Yeah, insurance.
And so then the next step is for them, I guess, to go to the room and be seen by the
Yes.
doctor, and the nurse first. No.
So that's what you're saying, ask
Yes.
them, ask them what information. Okay, so you
Yes.
go up here, the information, the address, hit with code, right before code.
Yeah, because
Okay.
because like the doctor has to come in and do something like say, okay, this is what's wrong with you, or this is what I think is wrong.
Right, okay.
You know, tests, stuff like that. I think so that comes after the demographic information. It comes after the demographic information. Sorry to repeat myself.
It's okay. And then when the doctor is finished with the patient, then they will pass that information on to the coder. The coder will abstract the information and make sure it is correct. Make sure everything is documented, corrected. make sure he's not missing
So
anything.
that's like that's the time that you see something that looks weird, that you need to go and catch the doctor or the nurse and ask, hey, is this right or whatever.
Yeah, and there's a timing for that.
What's weird? If you've been working in the office for a while and then you see something that just doesn't maybe make sense to what the doctor might have ordered, or then you probably want to go and check back with the doctor.
Or you try to put it in a code.
Yes.
Yeah, and there's a
Is that
time.
right?
That is very correct.
Okay, good.
You got the flow. You're in your zone. So medical records is your zone.
Yeah.
I want you to stay right there. We're gonna talk more about that. That is your
I
zone.
feel real good about that. Thank
Praise
you.
God. Yeah, I see that. Praise God. But there's a timing to that.
Okay.
So you don't want to tap the nurse or the doctor
Yeah.
when they in the flow of seeing patients.
That's
You
true.
kind of want to wait till like 4:00, 4:30, like 30 minutes before closing.
So you're
and
saying
deal
in
with
the
that.
office, what if I'm in emergency?
If you're in an emergency room and you're a medical biller and coder, they don't have those people in the same room. You're in a different room.
Okay.
And there's a different procedure of how that goes.
So you're, as if I was, but I know she was speaking as if she was just a private outfit.
Yes.
So I was saying if I'm in the big place in emergency room,
So say
I
like
see
for-
a different code that it was out.
Or if you see a different documentation,
Right.
but it doesn't quite equivalate
Right.
to what the code should be, then in the HIM room of the hospital, we have a separate desk with doctors' names on it that says, these are your charts. The notes are on the outside because we have to audit them, HIM people. This is what you need to fix. We already tabbed the sheet. You need to either sign it or fix it. When you finish, put it in the complete file. We can't mess with their flow in the emergency room.
Oh, okay.
So they
Can't
have
do
to
that. And you have to give them 24 to 48 hours to do that. Their adrenaline is high.
Yeah.
And they'll snap at you
Oh, they
because they're in the middle of thinking. So you have to put it there. What the HIM director does or supervisor manager does is take a tally of, okay, how many doctors we have for this problem, that problem, this problem.
Right.
Okay, so I need to write this doctor up and I need to give it to their chief medical officer. Their chief medical officer is going to tell them they need to come and fix it. We can tell them and remind them if we see them in passing, but if they're in a calm state, you kind of have to discern things. But I need you to, you get your feelings hurt. You get your feelings hurt. Don't do
I can
that.
imagine that. I wouldn't have thought of it that you brought it up, but yeah, it makes sense.
Yeah.
That'd be kind of high stress.
Yeah. So they have a different organized way of how they handle medical records and coding. And that's why they have them sectioned off different in a business office setting. Now, sometimes they have the HIM clerk stationed there, but still there's a policy with HIM department. You can't go and tap the nurse on the shoulder. The doctor can't do that. You have to put it in the stack, report it to your supervisor or your manager and say, hey, this doctor did this, y'all need to fix it. So he got 24 to 48 hours to fix that, or else we're going to get a dean from JCO or whomever, that does the accreditation for the hospital. And then she'll communicate with the chief medical officer, the big daddy of all the physicians.
Is he the one
And then he'll make them get in line and no, I need you to stop treating patients and I need you to come in this office and take care of this now. I'll get Dr. So-and-so to do your work. Because you have some, they get a high out of doing the work. Well, we just got to take a lot of pop from the baby.
So the chief medical officer are they in charge of all the doctors or is it per section of the hospital?
You have some that are sectioned off in the hospitals, but they're in charge of all the doctors. Yeah.
That's like being the president.
Right.
Yeah. That's like right up there with the CEO, the COO, the CFO. Yeah.
Okay.
The CIO. Yeah. Yeah. That's right up there with that. So you don't ever take things into your own hands. You don't treat it the same way you would a private practice.
Right.
And in a private practice, you deal with it at 4:00 or 4:30, never in the middle of patient flow. Is that clear, y'all? Okay, because you get your feelings hurt. Ooh, okay, very good. Okay, so moving right along. Let's come back. Anybody else have questions? Let's come back to the table of content. Okay, so now we have the medicine, services, and procedures, category 2, category 3, all that extra stuff. We have the appendices that's going to tell you what's been revised, what's been deleted, what are the brand name vaccinations. Sometimes you need to know that because a pharmacy may call, and even a pharmacist can give an injection. They can, just like a nurse. They're qualified to give injections. Oh, yes. And so if your doctor says that he wants you to have a certain injection and you have to go to the pharmacy to get it because they have it and they can give it, but they only have brand name. They don't have the generic. Then they may have to call for approval, or they may have to get you to tell the doctor's office, hey, they need to call to get this approved for us to have this paid for us to give this injection to you. So that's why they have that in there. Okay, now let's go to the first thing. Okay, now we're going to go to the orange section. I don't know how many of y'all have an orange section in your book. Okay, so let's stop for a minute. So you have introduction. So go to the introduction page. Introduction page. I skipped a page. Is everybody on the introduction? Yeah. 2 if you have a 2016 book. Yeah, you're on it. Don't move. Okay, great. So on the introduction, it's going to explain how some things go. It has the symbols and the conventions for this manual. Remember the other day, class, and I'm not talking to the new people just yet, but how when you all would find the codes, y'all verify what volume? What volume do you verify your codes? You sure? One. Mm-hmm. Very good. Okay, now, there you go. That's the sound. Okay, so on the bottom page, let's see if I can put this on the screen. On the bottom of this book where my pinky is pointing at, you have the symbols and the keys to kind of tell you what's going on with that code. Do y'all see that? Mm-hmm. It's just like it is in the ICD-10 book. Okay, you need to pay attention to the symbols and the keys that's at the bottom of the page. So kind of turn any color page if you want to. Turn to any color page. It can't be the gray page, just any color page. Color. Yeah. Perfect. Okay. So turn to any color page. It doesn't matter. As long as it's not gray. No. Go further deep. Go deep. 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 Yeah. See at the bottom? It has those keynotes and symbols. Mm-hmm. So when you start finding your codes, you need to pay attention to what those notes and symbols are saying. They're your guide to how to properly code. Does everybody understand that? Mm-hmm. It's just like it is in the ICD-10 book, right? Okay, so let's go back to the introduction sheet. Let's go back. I just wanted to show y'all this. And remember, I'm showing you this because sometimes we can miss out on information and it's right there in the book. And I'm teaching you how to utilize your book because why? Miss Harper is not going to be in your back pocket unless you text me and email me, and I still might not answer you fast enough. So you got to kind of, I'm sorry. So you got to learn how to defend for yourself. Okay. Now, instructions for using this manual. Does everybody see that? Page 3. Okay, if you have a 2016 book like I do. Okay, so the instructions for using the manual, it says see also. When we get ready to do some procedure coding, you're going to understand that. Okay, you're going to understand that. All right, now turn to the orange section. Orange section. Oh, I like that purse. That's pretty. Mm-hmm. Turn to the orange section. There you go. First sheet of the orange section. Orange. How many of y'all say orange or orange? Orange. All right. So this is the anatomical illustrations. Remember I told y'all about this show called The Good Doctor? And it's about, you know about that? And it's about the doctor who has autism. and he's a physician, and so he memorizes the illustrations of the parts of the body and how each part functions and how the physiology works. Well, he can go in there like that in his head and then say, oh, that may be the problem. It may be this or that. Well, kind of like the coder, I'm not asking you to be an aficionado like him, but you kind of have to sit there and kind of like, there you go. Yeah. Yeah. And like, okay, well, I need to know. So it's important to understand the parts of the body because you need to understand. Let me give you an example about what I mean. Let me write that on the board so you can understand why this is important. Remember, we talked about pre-K yesterday. We talked about the 8 parts of speech the other day. So y'all now y'all understand how pre-K through 12th grade is important, right? All right. So let's suppose this patient was having a pancreatectomy. Pancreasectomy. I hope I spelled that right. And ectomy is, what does that mean? No. I think it's removal. Removal of the what? Removal pancreas. Removal of the pancreas. Okay. So this is like okay. You have I hope I spelled that right. Remove. Okay. All right. So, because we had a pancreatectomy. Okay. So, as a surgeon would, a surgeon is going to go in. He's going to do what they call an incision. Okay, a small incision, which is known as laparotomy. Going into, cutting into, right? And remember, this whole section that he's healing, this needs to do one small cut to get to the pancreas. Which sits up under the gallbladder. Sits up under the gallbladder. Now, let's suppose within that laparoscopy, and I know I spelled it wrong, that he sees a polyp on the outside of your small intestine. A polyp is like a mole. You know, anybody ever seen moles on your body? Or moles on somebody
body, they like a skin tag. Okay. So a polyp is kind of like that. They're like skin tags on the inside. On the inside of the body.
Right?
Yes. Those are moles. But sometimes they get it big, like a raisin.
Oh.
So they're called skin tags. Okay, so I'm just trying to draw a picture of how you should see what a polyp looks like on the inside when he does the. It goes on the outside. He says, "Hey, I see a polyp on her small intestine." So now, in here, you see a polyp here, and you may see a polyp here. So within this same incision, within this same cut, and same opening, he's going to grab this and get that out. Gonna grab this and get that out while he grabs the what? Pancreas and remove that. All this is done through one opening. Does everybody understand? Mm-hmm. That's why you need to understand anatomy and physiology. Does it make sense? Laparoscopy one time for the pancreas and code the same code again for the polyps. Does it make sense to do that? No. Why?
If you're gonna constantly go back in.
Because he's constantly going, well,
Because it's one opening.
because it's one opening. Yeah, and he will go back in. You know, once he pulls out, he goes back in. He pulls out again. Yes, you're right about that theory. But you can't cut and then what we call is voluntary assault in medicine. It's called voluntary assault. Do the patient no harm.
So is that like when a lady has a C-section?
Yes.
You get your tubes tied at the same time?
Yes.
What?
Mhm.
What is?
So like,
Yes.
What is that?
Okay, so explain Mimi what you understood.
So instead of calling for me to get my tubes tied and get my baby to kind of C-section, they're gonna code it one. So I'm already open.
Right. We're removing the baby.
I didn't have a C-section.
But you had to go,
right? Or whatever. Yeah, pregnancy back then. So would that
Will be different. That's a very good example. Very good. And that would be different.
Incision.
It's still an opening.
I might have to see section and bilateral tubulation. That's the pancreas.
Pancreectomy. Laparoscopy. So, right, laparoscopy is that when a doctor goes in and he's your pancreas, and he see the pancreas. Right. It never was a happenstance, and it's within his scope as a surgeon. Right. He can do that. Right. He can do that. Understand as a C-section. The agreement with the doctor that you want to engage. So while he got the baby out, he cleans you up and take all away. In her situation, she gave birth, right? You still, but you're not open surgically. You're open naturally. As you understand that? And so for him to wait till the baby's out, again, he has to clean after birth. Mm-hmm. Now he has to make those for the instrument to get through. Right. And to do what it needs to do robotically. Do what he needs to do. Does that make sense? Mm-hmm. So I still have to charge you for an opening.
Excuse me. Prevention is not within the physician's scope. That means they have to code it differently.
Say that again.
If it's not within the physician's scope, but for him or her to carry out the second decision, that means they're going to.
Yeah, sure.
It's going to be coded differently. And let me say, ethically. Now, let's suppose he wasn't licensed to have different all surgery work, specialized in doing what they do. But now, if he wasn't specialized to remove polyps, and you're going to need a gastroenterology surgeon, then he's going to say, let's kind of temporarily close her up, or let's hold up a bit. Hey, I need y'all to reach Dr. So-and-so, because this is his scope. This is out of my scope. And he's going to do that. Just it happened with me like that, with my uterus. Even though I had weight loss surgery, but my doctor, my uterus was big as a 6-month pregnancy, the fibroids. It was huge. And my OB-GYN doctor asked, well, how come your bariatric doctor didn't remove your uterus and all? He said, I told my bariatric, he said, are you crazy? You know I could lose my license? That's out of my scope. No, that's his job. No, I'm not doing that. And I've been asking him to remove that long before the weight loss surgery. Do you understand? So now he ethically he closed me back up, but he brought it to mind. The 5 bariatric openings like they normally do with bariatric patients. He had to cut me open and remove my uterus to the side and then do the weight loss surgery and then put it back. Yeah. But that's okay. I love
Glad
him.
you're okay.
Oh yeah, I'm very okay. But my stomach was still out there because of the fibroid. So what ended up happening is I went back to my OB-GYN doctor. He kept telling me the same thing, kept referring me to another lady that was big shot at Methodist, GMC, not gonna give no names. I said, this is crazy. So what I did was I went back to my weight loss doctor and I told him what he said, what the other lady said. He said, I'm gonna refer you to my friend. I said, okay. If you have a good physician, always ask them who they know. Because good ones they know each other. Oh yeah, they know each other. They know who to recommend. So I went back to him. I said, my OB-GYN doctor won't do it. My OB-GYN surgical doctor won't do it. He said, well, I'm going to refer you to my friend. And I went to her about 1 or 2 visits. And then she was like, oh, girl, yeah, I'm doing robotic. We're just going to do this. I'm going to flip you over and flip you like that. She a little old lady. I'm going to flip you over and flip you like that. And then it's going to be a wrap. I said, really? I said, I don't have to lose the weight. No. Yeah. And I healed up in 8 weeks like everybody else normally when they I had a total hysterectomy.
Oh.
And I had to have it to lessen the chance of the breast cancer coming back. So I'm HR positive, HER positive, HER positive. You're RH positive?
Yes.
Okay, so that's your blood type. Yeah. I'm hormone estrogen receptor positive. So if I kept my uterus and kept having menstrual cycles, because it takes estrogen to create menstrual cycles, it'll restart the breast cancer, and it'll restart the breast cancer in my left breast. I already had my right breast taken.
My mom died.
I'm sorry.
Friday, May 5 years. Metastatic. I mean, her breasts were out here.
Yeah.
They were like bricks. It spread through all her lymph nodes.
Yeah. Metastatic. That's right. I'm so sorry. 10 minutes? Okay. Thank you, Dora. 10 minutes. Okay. But that's the type of blood. RH positive, RH negative.
Yeah, we have to take that shot.
So, but do you understand what I'm saying? Okay. What is that?
Okay.
Monica, did you understand what I was saying?
No, I understand. When I heard her talking,
Okay.
I know what, yeah.
Okay. So coming back to this, you can't code but one time for the opening. Only one time. And then you would code for this. So this would be a different gastro code. And then this would be a pancreas code. So we're going to do this. A pancreas. Okay, so I'm going to use this as an exercise. I'm going to use this as an exercise.
And wait, and you said only men have pancreas.
Only men have prostate.
Oh, prostate. Okay. Okay, so pancreas and prostatic is okay.
Isn't the pancreas the thing that puts out like certain hormones for digestion or something?
Um,
I'm trying to remember.
there are hormones for digestion. You have Pepsid. You have.
My mom had the surgery to get, her pancreas out,
Mhm.
and I can't remember like what is the pancreas?
I'll explain to you. It deals with the insulin, blood sugar.
Oh, okay. All right.
Deals with her blood sugar. Okay. So let's look at this. What I'm going to do is, it's 10 o'clock.
Yeah.
So I'm going to go ahead, let y'all have break, baby. And then we come back, we're going to code pancreas. Pancreectomy, and I'm going to find the proper code, proper name for this so y'all can code that. I want y'all to see what that's like.
Yeah, I need to code that.
Okay, sweetie. All right, so the book. Okay.
Get the information from you.
Okay. So this book here, no, I have it. It's in the midst of all of this.
Nobody in here have all that.
Hmm.
Nobody in here have all that. Yeah.
That's my daughter. Yeah, not me, but I was down to have a child that's left-handed.
I'm gonna bet
It's funny because when she was a little baby, like about a year and a half, my mom was like saying like, oh, she's left-handed, and so my mom it was and grab it, and so she's like, look, I'm gonna hand or something. But then she used to grab it. And you know what she did? She grabbed it with her right hand. But as soon as she grabbed it with her right hand, she transferred it to her left hand. And my mom was like, let me give her one more. And sure enough, she kept on putting it into the left
They
hand.
say they special because there's not a lot of them.
Mm-hmm. Yeah, and she, because a lot of people use their right hand somewhat.
I go way far back. Oh, you know what? Let me go into Miss Johnson. I know I sent it to her. That'll help me. 'Cause I've done so many text threads. No, I've done a lot of text threads.
You have all the answers. You got from 1 to 8, right? Let me talk to her so that I can get which one you have for the question. Sisters.
Oh, okay, here it is.
She needs 1 to 11.
Well, you gave me only the answer.
She got the
Let me turn this on.
I think how many people
Yeah, we have that else 1 to 8 work math.
8 to 10. Let me compile that for you.
I'm going to forward it to Miss Johnson.
You have 5 and 6. You have 5 and 6. You don't have
What the word? The answer
the
sheet. No, I don't have a worksheet.
which one?
Worksheet I have is 6 and 7. Answer key 1 through 8.
Hmm. Okay.
Yeah.
Think.
Bueno, no, quita.
Separate together. So can I get to worksheets. For 1, 2, 3, 4, 5. Worksheets meaning the key or the package.
Oh, God, that was way 2018.
Yeah, I'm done. Okay, so you need the key, right? For what? What do you need? 1, 2, 3, 4, 5. Chapter 1 to 5. No, this is the association. That's why I said the key or the package. Yes. Okay. I'm done with it. So we can use. You know what? Have you started working on it? Yeah, I'm already in chapter 6. But, so let's you definitely for chapter 3 and 5, you read as a yeah. And 10. Excuse me.
Yeah, baby.
We need the one.
Okay.
Say.
So here's what I'm gonna do for you. I'm gonna let I officially. Okay. So we are with that. Just make sure you operate it from here, so that way you don't lose anything. So now you need already in order, and like these are the already we already we already did this one and this one. So now we need this.
No, you have 6 and 7.
So here's 8. Then you can look at it from here. Okay, so here's 8, and you just need 9, the back side of that, and then sweetheart,
Don't worry.
and then this is 10. So ask John if he can make me about 15 of them, and then
Do we need the backside of this too? Ah.
so I need like 15 each of stack of just of the back side, and then 5 of each. Yeah, for my 2 ladies. Yeah.
Yes, ma'am.
1 to 5?
Yes. So this is 1 through 5. So yeah, just work with that for right now. And then I sent her the electronic, but I'm trying to go through my gallery here. But it's the only way I can get.
So we need, and I want you said it's the insurance help book.
Yes, ma'am. I'm gonna send you what you need, baby. Just give me a minute. Hey. I'm still in 2018. How I got to be in 2018. I started here February. Right? Okay. I started in February.
I'm sorry, come in. Please. Oh yeah, I'll turn it in. Oh, okay. I was gonna ask, so. Text. No problem, right.
Yeah, I'm like second guessing myself.
Second guess. I can look at it after class for you, sweetie.
Okay, thank you.
You're welcome.
Do that to myself all the time.
It's okay. I know I made copies. I know I've taken pictures. Now let me go back. All the way back. Okay, let's see something here. No, no, no. Nope. No, no. Nope. No, no. I know Sarah sent it to me. No, no. Oh, come on. Get back.
Here. So what I was gonna ask, where is Lamont? Do y'all know? Is she just not come today?
I think she had a doctor's appointment.
Okay, I thought you were about to say she had the baby. But
No.
I think I would have probably known about it by now.
No, not yet. Okay, here it is. I'm gonna forward it to Monica. Monica. Okay. Okay, so those are the list of Sarah sent to me. I'm gonna here. Good.
But this is on 3. You say we need 4, right?
Yeah.
Medical terminology, lecture medical record,
Computers in the medical office. 40.
Insurance health book. That's what
Okay,
she don't
that's
have on
4.
there.
Yeah.
Yes, ma'am. Okay, I'll be right back.
Okay. You
mind that it was gonna come out like blank.
yes. And then, okay. Miss Johnson. Forward to Miss Johnson. I'm sorry.
I'm right there when I'm okay.
Moving. So, does everybody know how it works now? You can only code for one opening. One opening. I'll leave it up there. I'm gonna leave it up there. I'm gonna leave it up there. I'm gonna leave it up there. Okay. See, Miss Sweeties. Let's see. I'm going to
At the end.
and I think I spelled it wrong.
Oh, no, I was just thinking like does that when it says tell me?
Uh-huh.
Okay.
So, move up.
Me. Okay.
Move up. I'm gonna leave this up here.
Yeah, you almost need 2 more boards, I think.
I do. I do. I do. I do. I do. Okay. Okay. So this is what we're gonna do, and I hope I spelled it correctly. So let me see if I spelled it correctly. P-A-N-C-R-E-A-T. Now I was missing a word, a letter. T. Yeah. Is she gonna have to be on an insulin pump?
Oh, no.
Okay.
Gallbladder out. It's like kind of in the middle, right?
It's right. Mm-hmm. On the side, not on top, but right up under your liver. Right up under your liver, and then your pancreas is like right behind it. Mm-hmm. So she has to have a gallbladder removed.
She did already.
Oh, she did already.
Actually, you know what? We were gonna go on a trip to Corpus Christi, and with my older daughter, my younger daughter, me, and my mom was just like sleeping all the time. She wouldn't get out of the bed, and we almost went on the trip, and I was like, no, something's not right, you know, because she likes to sleep. She will sleep. So it was kind of not go and, you know, leave her here, get rest, and come with me, or I'm gonna take you the way you are. You know, because I knew that they found out it was the gallbladder or whatever was the problem, and she went and had a surgery. They took her right away.
Yeah, because it would have.
She always tells me, she said, you saved my life. Yeah, she's like, you saved my life. If I was just gonna keep lying there in the bed.
There's the grace of God.
Yes, the
Yes.
grace of God. Yeah. You're a good daughter.
Oh, thank you.
You are. Yeah. You're a good daughter. She's blessed to have you.
Yeah, when you know when you get a feeling, you gotta really act on it.
Yeah. When you get a hunch, you gotta act on it.
Yeah.
Very good. Thank you for sharing that. Thank you. Okay, so now we're gonna start working on coding. So what I need everybody to do is kind of backwards this time. Okay, so I need everybody to go to the back of their book. Back up your CPT book. I remember where I'm at. Okay, go to the back. It should be a glossary. This book is so confusing. Yes. Yeah. Just replay the two, baby. I'll put it on the text thread, okay?
When you say a glossary, do you mean a glossary of codes?
A glossary of words. See, yeah, glossary of words. Hold on just a minute. This book is so dear. Ooh, it's so different. This book is so different.
Category code.
Yeah, that's not where I want to go. I'm gonna show y'all a difference. I'm gonna teach you how this book works. You're an 18? Okay, that's fine. It's the same thing. AAPC coding book work versus my coding book. Okay. So, because I'm used to my book. And I have no problem with that. Okay, so now for the AAPC, if you're using the AAPC book to the front, the gray area. Gray area. Uh-huh. And I want you okay. I'm gonna tell you what page to go on if you have 2016. And then those that have 2018 will coincide. So don't worry. Don't fret. Okay. The index is in the front of the book. Okay, so let me show y'all. And it's on page 265. Yeah, 265. So in the AAPC book, the index is on the front. Okay, of the AAPC CPT coding book is in the front. Okay, now let me show you how it looks in the other coding book. In this coding book, and it's not as thick, in the American Medical Association CPT book, information is still the same, but the index is in the back. It's in the back.
So which one do you prefer? Like,
I'm gonna tell you in a minute.
okay.
Yeah. So in the American Medical Association CPT book, the index is in the back. Okay, it's in the back. And remember, for the AAPC CPT coding book is in the front. Okay, that's why I'm telling you this, because when you get ready to take these coding exams, not application for your close your eyes, certification exams. Okay, just tune in, honey. You'll catch it. The coding certification. Please understand what book you bought and how to use it. Please thumb through your book and find your tools of what you need. This is a tool. Find your guidelines. Those are tools. We went over that. Study and know your book. Don't assume, oh, well, this book should function like this book. No. Both of these books, they have same similar information. It's just how you research information is. Please equate yourself. You're gonna mess up, and you're gonna waste a lot of time, and you're gonna be frustrated. To make friends with your book. Your book is your friend. You have to know how to work your friend. Okay? All right. So everybody should be on page 265. Sweet love. Go to 265.
I just wish our friend wasn't so heavy.
I know.
We need.
I did. You may, but in the real world, in the common world, this is what you're going to be using. Y'all know